All right, guys, so the first thing I wanted to do was talk about some of the different vertebrae that we're going to encounter in the spine and how to identify each of those vertebrae by their distinguishing characteristics. So let me move this in a little better spot here so you guys can see them. So first one we're going to look at is going to be this cervical vertebrae. Now, we know this is a cervical vertebrae by a couple distinguishing characteristics. One is really small vertebral body. Okay, so when we see a really small vertebral body, we're going to think cervical vertebrae. The other more distinguishing characteristic are going to be these transverse foramen. So if we see these transverse foramen, two things should come to mind. Number one is that, yes, we are looking at a cervical vertebrae. Number two is what structure is going to travel in that foramen. The big structure that's going to travel in that foramen is going to be the vertebral artery. So just be aware of that. Other thing I really want you to note with the cervical vertebrae, the thoracic vertebrae, and the lumbar vertebrae, in addition to how big each of the vertebral bodies are these zygapophyseal joints or facet joints. Each section of vertebrae, cervical, thoracic, lumbar, are going to have a different orientation of those facet joints. With the cervical vertebrae, we're going to see a very 45-degree pattern. You're going to see the facet joints oriented at 45 degrees. That's going to lead into, and we're going to get into this in a later section, something called a coupled motion. So we're going to see ipsilateral side bending coupled with ipsilateral rotation. What that means is that when I side bend, I'm also going to have a little bit of rotation because of the orientation of the facet joints. In the thoracic spine, we see a much different orientation of the facets. They sit almost in line with the frontal plane. Now that's going to give us a lot of clue to what available motions we have. So in the thoracic spine, we're actually going to see that we're going to have much more side bending than we will rotation. If you think about it, if you rotate, not a whole lot comes from your thoracic spine. In the lumbar spine, really interesting thing here, look at the orientation of those facet joints. Those are almost in line with the sagittal plane. Okay, there's a little bit of a skewed orientation, but a lot of orientation with the sagittal plane. So that should give you a clue on what available motions there are at the lumbar spine. Yes, we can rotate at the lumbar spine. Yes, we can side bend at the lumbar spine, but flexion and extension are going to be our main motions there. So understanding why we have different motions at different vertebral segments, understanding why we have different availabilities of motions, and then understanding how the morphology or the shape of the joint really is going to help you with determining what motions are available. Also understand how the orientation of facet joints play into that. Next thing I want to look at is specifically the atlas and the axis. Let's remember that my atlas is going to be my C1 vertebrae. It's going to look just like this. The reason it's called the atlas is because it's going to hold my large cranium and it's going to hold everything. The axis is going to be underneath. It's going to be inferior. Now, in this particular model, the C2 and the C3 vertebrae are fused. Remember, my C2 is going to be my axis. Down here is going to be my C3 vertebrae. I just want to mention that so you guys don't get confused. The odontoid process, or the dens, is going to be on that axis. The odontoid process is going to fit right into this space, okay? What we will see is that this odontoid process, because of its transverse ligament and because of its alar ligaments, is not going to necessarily allow for, and the morphology of the bone is not going to allow for a lot of flexion and extension. Let's think about this. If I look at this from the lateral view,
I'm not getting a lot of flexion there. I'm not getting a lot of extension there. I'm also not getting a lot of side bending, right? The bone is hitting the bone. What I do have as available motion is I have rotation. As you can see, I can freely rotate that atlas on the axis. So what we're going to see is the majority of rotation is going to happen at this joint. The other thing I want to mention, again, this is going back to the different morphology that we're going to see in each joint. I still have transverse foramen here. This one we don't see it that much. They would be there and there. But I have transverse foramen definitely in the atlas. So next thing I want to look at is this concept of coupled motions. Obviously what we're looking at here is an entire stack of cervical vertebrae. If you look down closer, what's going to be off camera, you're going to see thoracic and lumbar vertebrae. So what I want you to look at here is how the articulation, specifically those facet joints, articulate or touch one another. That's going to lead to this concept of coupled motions. What we're going to see is when I rotate a cervical vertebrae, it's going to hit the next lower and higher vertebrae at a little bit of an angle. What that's going to do is that's going to allow for another coupled motion to happen. Okay, so it's not going to be one motion, it's going to be a couple motions. Here's how it works. So I got my posterior section of my vertebrae. If I side bend, and I side bend specifically this vertebrae, what happens is this vertebrae, or I'm sorry, this facet joint, you can see slides superiorly a little bit. Okay, so there's a little bit of what we call a gapping. This one slides back a little bit, but because it's also at a little bit of an angle, it's also going to rotate a tiny bit. So what we're going to see is that ipsilateral side bending, and you guys can kind of see this in the spine's processes, ipsilateral side bending causes a little bit of rotation as well. So those two motions are going to be coupled. Big important point when you're a physical therapist, because a lot of times if your patient's lacking side bending, you can work on things like rotation, and it can actually help side bending as well. Getting into the lumbar spine, much different orientation here, right? So remember, facet joints are oriented much closer to the sagittal plane. What I'm going to see here is I can have some side bending, and I may still have a tiny bit of rotation. I can have flexion, I can have extension. I can have flexion. Big thing to note here, and this is what's going to help out your patients a lot, is when I flex and extend, I have to be aware of something called gapping and closing of these facet joints. So if I extend the lumbar spine, those articulations are getting closer to one another, okay? If I extend and rotate, now they're almost touching. If I flex, I can see how much space I'm creating between those two articulations. So big things we need to note here as we move into the spine.